Hi everyone, this is my problem solution project called Computational Biomechanics, a solution to surgical consequences. My name is Christian Berhel. Um, well, the situation is that currently the number of surgeries and new treatments performed worldwide has increased considerably. As you can see, the United States is the country where the largest number of surgeries are performed, followed by Brazil, Mexico, and Germany. Colombia, for its part, is in eighth position. The problem with these all new treatments are that in many cases the consequences are not evaluated. This means that there is no objective evaluation of the result of the new surgeries and how can they affect the patient health in the future. Additionally, it is impossible to determine which surgery is best for a patient or for another. There is no objective measure to determine the advantages or disadvantages of one surgical treatment over another. An example of these cases where surgeries can have consequences for the patients are surgeries performed on the or are performed to treat the osteoarthritis of the ulnar radiodistal joint. The most common surgeries are the Darash procedure that you can see in the left, which involve the removing the head of the ulna, and the Savaka-Panji procedure that you can see at the right, which involve cutting and fixing the head of the ulna to the radius. These surgeries can cause pain and instability on the patient's wrist, or something also called síndrome de pinzamiento. This is where computational biomechanics are useful. With the use of computational tools and medical image, it is possible to create precise models that represent the behavior of the body when performing different surgical procedures. These models, as you can see on the image, are made by the means of a three-dimensional reconstruction of the body segments, the positioning of these reconstructions in the desired position, and by means of the mesh applied to it. It is possible to carry out simulations that evaluate different surgical treatments. With this, it is possible to determine which treatment is more recommended to a specific patient. So, here is where I ask you, what if we could individually assess each patient in this fast and effective way? Could be considerably improve the health of the people who daily undergo surgical surgeries? Will the cost of this procedure in hospital decrease? Well, this is something that is not far off in time and that little by little will be implemented in the health system. Thank you.